Welcome back. Now, during a routine testing of sewage water environmental surveillance to detect viruses early, the Ministry of Health and Social Services detected poliovirus type 2 at Ndama Sewerage in Rundu, Kavango East. Although no case of polio have been reported, it's a precautionary measure to protect children and keep Namibian polio-free. The Ministry of Health and Social Services is vaccinating all children under the age of 10, including those already fully vaccinated. The next nationwide round will start today, the 26th, till the 29th of January, and again the 24th February till the 27th of February 2026. Now, to enlighten us more, we are joined virtually by Ida Mendai, the Kavango East Regional Director in the Ministry of Health and Social Services. Good morning, ma'am, and thank you so much for making time to speak to us this morning.
Good morning, Namibia, and thank you so much for having me this morning.
Okay. Now, polio can be prevented through vaccination. Now, every child receives an oral polio vaccine at birth, and thereafter, briefly talk to us about what NOPV2, that is a novel oral polio vaccine type 2, is all about.
Thank you so much. Before I come to that, I just wanted to say that polio is a very infectious disease that can cause lifelong paralysis of limbs, the legs and the arms, and all may lead to death in children. So there's no cure, but polio can be prevented through vaccination. So the novel oral polio vaccine type 2 is an updated oral polio vaccine specifically designed against type 2 poliovirus. It is a modified version of the previous monovalent type 2 oral polio vaccine, which is developed to be more genetically stable and to reduce the risk of vaccine-related poliovirus outbreak. So in brief, that's how the novel oral polio vaccine type 2 is defined.
Thank you so much for that definition. Now, we understand that the Ministry of Health and Social Services is vaccinating all children under 10, including those already fully vaccinated. Now, why are children under the age of 10 the most vulnerable group for transmission?
Yes, the children under the age of 10 years are the most vulnerable for now in the target because this one, their immunity is low, so we want to target them to ensure that we prevent this poliovirus from infecting them. So that's why we are really targeting them. It's not for the above 10, but it's every child of this age group should be able to receive this vaccination because of their immunity.
How is this vaccination different from the routine polio vaccination given to children in the previous campaign? And why does this routine polio vaccination not prevent poliovirus type 2?
Come again on that one?
This vaccination that is being given to children this time around, how different is it from the previous one? Because one would have thought if the previous one was given, then there is not necessarily a need to give this type 2 polio, or is the previous vaccination not capable of fighting against this polio virus type 2?
Why we are doing this one? Because Namibia has not had a polio case since 2006. It has history. And also, however, during the routine testing of the sewerage water environmental surveillance in Ndama, in Kavango East region, this type 2 then was detected, like you have rightly said. Although we don't have cases now, it's a warning sign to the country. So it's very important that we protect children and keep Namibia polio-free. So the Ministry of Health now is embarking upon to vaccinate the children under the age of 10 years. So it's very important that these children get vaccinated so we prevent any case from happening.
Okay. Now that we have established that the previous polio vaccinations are not capable of dealing with this transmission, do children who receive their routine polio vaccination still need this vaccination during both rounds of this campaign, now in January and then in February?
It's very important because it's a special polio vaccine campaign. like you have rightly said in your introduction to say, we did round 0 already in December, 15 to 18 December. So now we are doing the nationwide. So children who were vaccinated during the round 0, and now those one who were not vaccinated are all now have to be vaccinated towards these 2 campaigns. I think it's this round 1, and we still have 1 in February. So all children who were vaccinated, not vaccinated in the previous round are all eligible to be vaccinated towards this campaign, which is starting today, to ensure that we really boost their immunity. So vaccination teams will be all over the regions countrywide. All communities will have these teams to ensure that we reach every child who need this vaccination. I'm repeating again, it's under 10 years. It's not over 10 years, but all children under 10 years, despite their vaccination status, they must come and get their vaccination.
Now we understand. Thank you so much for that. We understand that most children do not experience any side effects after receiving the NOPV2. But for those who might experience side effects, what are some of these side effects that they might experience?
Well, yes, we don't, like you have rightly said, we don't have much reports on the side effects of children, but should there be any observation of any kind, these children should come to the nearest report, to the nearest facility, and then we'll be able, with the ministry, to handle it. But this far, we haven't noticed any side effects of any side effects of this vaccine.
Okay. Now, you also rightfully indicated earlier that polio is a highly infectious disease that can cause lifelong paralysis of limbs, legs, and arms, or may lead to death even in children. So when can parents and caregivers seek medical attention when suspecting that the children is infected with polio? And can children get the vaccine if they are sick or not feeling well?
Like I've rightly said, that all children, they should receive their vaccines as they are all eligible under under the age of 10 years. And then should the families, parents, caregiver experience any side effects, they should be able to alert or come and report to the Ministry of Health and Social Services. We will document and then handle the case accordingly. But like I've said, we have not received any side effects from our experience of the previous round.
What happens, Madam Director, if a parent should suspect that their children might already be infected with, that is, polio? What then that happens? Do those children still remain, do they still get a vaccination, or they don't get a vaccination while they possibly might be infected with this polio?
They should be able to receive their vaccines as they meet the requirements, and then we handle the other signs which the parents is seeking by investigating it and so on. Yes, all children, whether you have fever or they are sick, they should be able to be vaccinated. We are not sending them out. Yes.
So children in the Kavango regions who were already vaccinated in the previous round, should they still get vaccinated again, and how many doses should each child get?
Yes, Kavango East region, you are called this morning and come and get your children vaccinated. Your children were vaccinated before. We are inviting you all that you open access so that we reach you to be vaccinated. And we are only giving 2 drops. It's only 2 drops, which is administered to every child, easy, and it won't have any side effects. It have been proven. We don't have data on this that we can therefore share evidence for now. So we urge all communities to come starting today and get their children vaccinated. Yes.
Okay, let's talk about how community leaders and religious leaders can help and support the ministry during these campaigns.
We want to humble ourselves and ask our community leaders to help us. Like you look at the one now, the roads are not accessible for the health teams to the children. It's very important that they help us to sensitize and raise awareness among the communities, to let them assemble the designated areas in the community where community meetings happen and so on. So if they assemble, it makes it easier for the teams to reach them. And also teams will be very mobile, will visit malls, will visit communities, will go in hard to reach areas, will be there, will do house to house. They will have identification bands which they will put to know that these are those teams coming to vaccinate these children. So our leaders must help us here to ensure that caregivers, community leaders, schools cooperate with us so that we do this to protect our children from any disease, polio-related. Thank you.
Now, finally, type 2 poliovirus can still circulate in under-immunized communities. What is your message to the parents and guardians that are against vaccinations?
It's just to be to be really precautionary in terms of prevention, that ensure that proper hygiene is maintained, proper hand washing with soap and clean water, and also when they use toilets and before preparing foods, before feeding, all these, they must ensure that their hands are washed properly with soap and ensure that the home is clean, and also safe disposal of human waste and access to clean drinking water to strengthen our prevention efforts for this polio. So we really urge our communities to ensure that these practices, these health practices are maintained in homes, in communities, in schools, especially schools. Let's ensure that there's running water, there's hand washing facilities, there's soaps also in schools to ensure that children have access to hand washing. Because if our hands are washed, this is where the start of the infections, and we transmit it to one another. So if we maintain it, if children are taught how to wash hands as a routine and regularly, I think many diseases will be prevented in this way. Thank you.
Well, Madam Mendai, thank you so much for making time to speak to us this morning, and we wish you all the best as you roll out this campaign that is starting today.
Thank you so much. We wish Namibia a very successful campaign, and we hope we'll achieve our targets as set by the Ministry of Health and Social Services. Thank you so much for having me.
Thank you.